for joining me for Medicare Supplements Made Simple. If you're looking for a better understanding of what a Medicare supplement is and how it might fit into your Medicare needs, then this is the video for you. Stay tuned. Hi, I'm Ariel with Distinguished Choice Insurance Solutions, and we are a team of local insurance brokers. We are located in Las Cruces, New Mexico, and we service New Mexico, Arizona, and Texas with all of their health insurance needs. This video today is all about making Medicare supplements simple, making them easy to understand, giving you the feedback of what our clients say are those pros and cons, and then also giving you our experience. Our team has over 50 years of experience working with clients, giving them that unbiased perspective. And so what we want to do is turn these supplements simple for you. So we're going to go through some of the basics of what to look for, when, who gets these policies, and why folks get these policies. We're going to be straight up front when it comes to some of the positives and the negatives on both a broker's perspective as well as clients that'll tell us their feedback on a regular basis. So to get started understanding a Medicare supplement, you first have to understand original Medicare. So Medicare is for those who are either 65 or on disability. And Medicare comes with two basic pieces, Part A, which is hospital, and Part B, which is the medical side of things. Now, a lot of people think that once they start Medicare, it's going to cover everything, right? So 100% coverage in and out of the doctor with no costs. Unfortunately, that's just not how Medicare works. Medicare A and B leaves people with deductibles and 20% coinsurances. So one of the top things about just having Medicare A and B is that it leaves you very susceptible to large costs. When someone would tell you that there is no maximum of how bad or how high your 20% could be, that might be something that concerns you, and that's exactly where a Medicare supplement comes in. So with a Medicare supplement, original Medicare is your primary, so it pays first, and then comes in your Medicare supplement as a secondary. Now there are 10 standardized plans. Standardized meaning that every carrier can offer these plans and they must be identical in benefit. But there are a few things that fluctuate, and so we're going to talk about that as well. So when you're looking for a Medicare supplement, one of the key goals is how much coverage do you want? Are you looking for the highest end and the lowest out-of-pocket costs like co-pays and deductibles? Or are you looking for something a little more on the moderate side where you feel comfortable paying for some co-pays and so forth? In some of our future videos, we are going to go deeper dive into specific plans like Plan G, Plan N, Plan F, and so forth. In this case, we want you to understand that Medicare is your primary, the Medicare supplement is your secondary. So oftentimes from clients, we're asked why. Why do I go with a Medicare supplement versus other options that may be out there? And so to kind of bring it down to a few basics, some of the major perks or positives that you'll find with the supplement is that number one, there are no networks. So you therefore can go see any provider nationwide that will accept Medicare. There is no in-network or out-of-network. These aren't PPOs or HMOs or anything like that where you have to work around contracted providers. So therefore, supplements give you probably the broadest access possible to see providers that you feel you might need or that a provider would refer you to and so forth. So number one for most people is the access that a Medicare supplement gives them. Number two is that anything that Medicare covers, a supplement would mirror. And so therefore, most people say, well, there's less restrictions, there's less prior authorizations, and ultimately a provider would tell you that there are less hoops to jump through. So when original Medicare says that what you are having done is medically necessary, then a supplement will follow up as your secondary without questioning exactly as much as we may see some other policies question. So in this case, anything original Medicare covers, your supplement would cover as well. A third thing for a Medicare supplement is that they are guaranteed renewable. So we often get asked by clients, are they going to kick me out when my health gets bad? No, as long as you continue to pay your premium every month, your policy is guaranteed to renew for the rest of your life. Pay your premium, keep your policy. It's that simple. You cannot have an increased rate for your health either. So although you may have had a rough year, you're not going to see your premium increase because of the claims that your policy had to pay out. Now, there are two other pros that we bring up often. So number one is going to be that you can reshop a Medicare supplement plan any time of year. So if you feel like your premium on your plan is going up and you want to get an idea of what other carriers offer, you can actually change Medicare supplements or check them out any time of year. There are no enrollment periods for a Medicare supplement. Therefore, it could be the middle of the year and you want to shop around a little bit, or it could end up being the annual enrollment period every fall. But in general speaking terms, you can look for a supplement at any point and you can make those changes at any point as well. Another thing for Medicare supplements ultimately is when clients tell us that they want as much coverage as possible. They are trying to keep their out-of-pocket costs as low as possible. They don't want co-pays. They may not want deductibles and so forth. So when it comes to a Medicare supplement, these are the richest types of plans out there. Now the downfalls, of course, all Medicare plans are going to have their shortcomings or things that we just wish there was this perfect plan out there. So let's get started on those things. Now, when it comes to a Medicare supplement, we know there are just a few things that they do not cover. So because Original Medicare, A and B, does not cover dental, vision, hearing, transportation to doctors, and things like that, you will not find those covered in a standard Medicare supplement plan. Those just aren't part of how these plans work. So although they may be exceptional medical coverage, you're not looking for these plans to offer you the dental, the vision, the glasses, the hearing aids, and so forth. So for those types of things, you're looking to purchase additional policies, or there may be possible discounts with some supplements. Different carriers offer different discounts. It may be a gym membership that they offer, or a discounted hearing aid. But to say that they are actual dental policies or built-in vision or built-in hearing, that's not something that you're going to find in a Medicare supplement. So another thing that we tend to get calls on, and I think every broker probably across the US gets the same calls, is that premiums go up. And I guess if you are looking for a Medicare supplement in hopes that it's going to lock in a rate for the next 5, 10, 20 years of your life, that's just not what you're going to find. So all Medicare supplements go up. And the way they go up is that these carriers look at how much are they paying out in claims and how much do they need to raise premiums in order to be able to stay sufficient. And so for most Medicare supplement carriers, you will see annual increases. Now, these carriers can decide how much those increases are, and they are regulated by the state. But oftentimes we see our clients getting anywhere from a 5-10% increase, pretty standard, and that can occur once or twice a year depending on the supplement that they chose. But what we want you to understand is that Medicare supplements do not lock in a rate. They are rates that increase, and that's how all supplement carriers work. When someone contacts us and says that this supplement is no longer in their budget because it's been 5 or 10 years and it's gone up while their Social Security check has not, we understand that, and our goal is to then find alternatives or maybe lowering coverage in order to stay within your budget. Now, one of the key things that we really want to stress in this video is how important timing is when it comes to a Medicare supplement. So generally speaking, you have 90 days or so before your Medicare starts. And that's when you want to start getting that homework done. Finding a plan, go ahead and get enrolled in it and ready to go for when your Medicare starts. You have a 6-month guaranteed window. Now, during this guaranteed issue window, any carrier must accept you. It does not matter what your health conditions are, your medication lists, if you recently were in the hospital, or if you had a recent diagnosis. For 6 months from the start of your Part B of Medicare, nobody can turn you down. Nobody can raise your rates any higher based on health conditions. Now, that is great for someone who knows exactly what they're looking for. What we stress to people, though, is the people that want to maybe hold off on getting a Medicare supplement. It is what they want, but they'll wait a year or two to get it. And we get told that quite a bit. What you have to keep in mind is that after this 6-month window ends, you no longer have a guarantee into them. And so therefore, there's this thing called underwriting. And underwriting is where a carrier can look at your medical background. They can see any medical needs, diagnoses, medications you're taking. There are actually carriers that will also look at height, weight, things like that. And so it does make it more difficult to get a Medicare supplement after your 6-month window has ended. Now, we get asked quite often, well, what happened to that no pre-existing conditions thing that happened with the Obamacare? Unfortunately, that does not apply to Medicare, nor Medicare supplements. So there are such things as pre-existing conditions. They do want to see your medical background because ultimately they want to know what they're getting into. If they're going to be on the hook for paying your co-pays, deductibles, and medical bills, they want to know the client that they are saying okay to come into their plan. So it's really important to know the timing. Again, the first 6 months from starting Part B is the ideal time if you want a guaranteed issue. Now, can you apply down the road? Absolutely. It could be 2 years down the road, 5 years, 10 years down the road. But what you need to know is those underwriting questions for each carrier will be there. And they each will want to know whatever their list of questions is. Some of them are a little easier to get through. Some of them are a little more difficult to get through. There are 2 things that can happen if you apply down the road. And that is, number 1, you can be denied. So they can flat out just say, I'm sorry, we are declining your application based on medical history. Another thing is that they can actually increase your rate. So whereas if you were 65 and newly eligible, you may have been a certain rate, but now you're 70 with health conditions, and they may increase your rate in some cases pretty drastically. So timing is really everything. All right, so let's wrap this up and keep it simple. A Medicare supplement is ideal coverage when you're trying to avoid out-of-pocket costs. When you are looking for a secondary to pick up majority of the costs that Medicare doesn't cover, and that way you're staying away from those unknown expenses, whether it be a chemo treatment or a triple bypass, or maybe you're someone on the healthier side that just goes to a few doctors but really doesn't want to worry about the what ifs. Now, Medicare supplements, you're not going to be looking for them to provide you dental, vision, hearing. You're also not looking at them for your prescription coverage because, again, a supplement is only medical coverage. And you do know that these rates are not locked in. So shopping around is a smart thing. Now, in this case, we want this to be personalized. And with Distinguished Choice, if you are in southern New Mexico, we come out to your home, sit at your kitchen table, and offer you assistance in person to tailor these plans to your needs, your budget, and your lifestyle. We also do a lot of our services over the phone, and so therefore we help educate you. Make sure you understand what Medicare is, and we're never a 1-800 number. So when you do work with us as a broker, you're getting our cell phone direct to us, whether it's a 6:30 call that I get at dinner, or whether it's that 9 a.m. I have a claims question call. So our goal is to make it personal, to make sure that you are getting the best benefits to meet your needs. And I really hope that you learned something today and they made this as simple as possible. And I can't wait for you to tune in on our future videos. Have a great one.